Okay, I apologise for that disruption, and we're now into part two and talking about a training aid. So, a lot of respiratory challenged horses, and a horse really is one breath per stride. So, their lung function's critical for them to move their skeletal mass athletically. So, if their lungs aren't clean, then or functioning well, they're never ever going to be able to run a decent time or race. So, what we can do as a training aid is a lot of trainers are using it before they do the track work early in the morning to open the airways up, clear everything out, and ensure that the horse can obtain its VO2 max, and the throughput of a champion athletic horse like Black Caviar or Winx or any of our great horses, whether they're a sprinter or a stayer, it doesn't matter. At full work, their VO2 max or the oxygen throughput is about 2,000 litres per minute. So that's a hell of a lot of air going in and out. A lot of the horses that we treat, they aren't up to those sort of levels, and these are tested with masks and things on treadmills is how they're assessed and tested. But basically, what we can do is we get these horses, and quite a few of them, if they've got undiagnosed lower airway disease, for example, I mean, the vets can't diagnose or treat it, but essentially they know that these horses, 65% of the industry waste is being cast off for non-performance. That was a recent UK study. So if we really care about welfare, then we need salt chambers in all the racetracks to ensure that we're not throwing any babies out with the bathwater, any good horses that really can be treated. So going back to the VO2 max, basically we get horses that are, 1,200 litres per minute, 1,400 litres per minute, and with the opening up of the airways and using the salt therapy before track work and training, we can get them up towards the 2,000. We've seen in the testing that we've done going from modest, weekend horse sort of rates and levels to the elite level of racing, and that's when you're going to see the best out of them. Also, with regards to bicarbing or tubing, as it's known, it's a hideous practice, cruel, and banned in all racing jurisdictions around the world. However, we can infuse bicarb into our treatment salts and deliver it via the lungs very safely, very effectively, not interfering with any TCO2 levels. We've been doing this in up the east coast of America for some time with great success and no problems with flagging stewards or being a problem. And this is important because the normal method is to get it into the gut and then the horses scour, and it's the same with athletes, Olympic athletes. If they're using bicarb, they drink it. You've got to have a top up before the race, and you'll see them being interviewed on the pool deck, and they'll say, "Excuse me, I'm going to have to cut this interview short," because they'll literally scour the same as a horse does, and you don't want to see, some of our top swimmers, Ariana Titmus and some of the great swimmers that we've got have an accident on pool deck. So generally it's a much better approach to ingest properly subscribed and measured amounts. And we know what the size of the lung is. We know what their breath rate is at rest. A horse can breathe between 9 breaths to 12 breaths per minute at rest. We know the size of the lung capacity, and we know the salt and everything that we're putting into the chamber. So we can manage that in a very, very refined way, which is going to stop these dodgy industry people from getting behind closed doors, trying to do the wrong thing and upsetting the industry, because someone's going to film it and it's going to end up being a big scandal to racing, and we're on a knife's edge with welfare. People want the horses to be looked after, and we're certainly able to do that. What I'm going to do, I'm just going to bring up here on the computer our patented chambers. So, yeah, you might want to have a look at that. I could be a bit more techie and have all this stuff on proper format, but these we can drop in at any racing centre and they can be moved because of the carnival nature of the American and Canadian racing seasons. It tends to move from one place to the next and go around like that. These can easily be used in that way, as well as our transportable chambers. And at this point in the conversation, I would urge to be on the lookout for cheap knockoffs and copies of what we've done. We operate within 7 pillars of what the racing stewards need us to do, which gives us the privilege of being able to treat right up until race day. Not on the day of race, but basically the day before. So part of that is not to be a source of bacteria or disease spread. So we have the highest hygiene standards in the industry in terms of swabbing our chambers every 6 weeks, and we keep records of the hygiene status of both the mobile and the drop-in chambers. And also, we don't have any banned substances in or around the chamber at any time. And also, with our record keeping, we are basically keeping track of which horses are treated and when. So if the stewards need access to any of that information, it's there and available to them at all times. And we also are not treating on race day, which is something that they don't want to do, because it's not what's wrong with salt therapy, it's what's right with it, is what the stewards have told me. And obviously, if they're in a chamber, they can be doing other things which the stewards are a bit concerned about at this stage. Part of the requirements is the insurance. Obviously, our modality is easily insured. We're a registered training organisation with IICT, and our practitioners only pay about $360, $380 a year, and that gives them $10 and $20 million public liability cover. So all of these things are taken care of in our training, but again, as I said, there's copiers out there trying to flog equipment and their duty of care, and also you want to work in a highly regulated industry. So the only way to do that is with the real McCoy, not people pretending that they're innovating or doing something. I've seen some extraordinary claims in the last 12 years, and nothing ceases to amaze me when it comes to the greed of people and the audacity of them to try and copy. The world's full of great ideas. Fill your boots, go and come up with your own. But I invented salt therapy, and it's my life's work, and I'm very passionate about the use of it, and certainly the ability for us now to share it with companion animals, other farm settings, including livestock and whatnot, is also very, very important to us in the future of what we're doing. So in wrapping up, I want to thank you for your time and putting up with my interruptions during this presentation. I know it's just basically a bloke speaking, but it's something that is important to the industry, because we need to be a bit more responsible when it comes to the care of these equine athletes. They're absolutely invaluable, and the industry is doing a great service to these animals and the participants. It's generally the second largest employer in the country, whether it's America. I mean, California has its equine population is equivalent to all of the horses in Australia. So if anyone needs any more information, contact me direct, Richard, at equinesalttherapy.com. Just email me. I'm always happy to share any information and discuss anything and any questions that you might have. And I'd be happy to foster any conversation beyond my keynote address today. And we're also very proud to have sponsored the HorseTech conference since its inauguration in London, which I was very lucky to speak there in person. So I'm sorry I couldn't make it to San Diego, but exciting things on the horizon. I'm off to play a tennis tournament in Thailand next week, and then when I come back, we're going straight to North America. So we've got a handover in Phoenix, which is very exciting for a new practitioner there. So we can't wait to launch them. And there'll be lots more of that on our socials, Equine Salt Therapy on Facebook and Instagram and whatever else is floating around. Then, we're straight into Ontario. Another practitioner is, I think we've sold our people in Ontario. They have bought 2, including Woodbine. Then there's another person we're going to be launching in December. Their trailer's being constructed right at the moment. And we've got a couple in Alberta, and things are really starting to heat up there. So we've got business partners in Molly and Coleman Stern who run Canadian Equine Salt Therapy. They're wonderful and most helpful with getting a lot more of that detail on the launches for our practitioners. So for now, I'll leave the conversation where it is. And as I said, for us, it's not just all about respiratory. I mean, we've got a multi-million-dollar business just on skin, and we have Oldie Salt Paste, which is a byproduct, also being launched. That has really come about because the trainers in Florida noticed the staff putting the byproduct of the salt treatment, this fine talc powder, straight onto the wounds of the horses. So we've managed to turn that into a paste with some other magic ingredients in there, which also keep flies off and are very good for wound care, and also for your saddlebag. For a lot of the cowboys, we've got basically dry components that go into a spray bottle, which you can fill up and spray onto the animal. So great for wound care, packing, all sorts of things. The results, the field testing's been almost 2 years with Dr. Peter Angus starting that off in Melbourne, and then our Canadian vets being very supportive in all of those areas as well. So more to come on that through the socials. We can't wait to show you guys all of that, and certainly stay tuned for these next couple of launches. And we are looking forward to a bright future where we can, even if we treat 10% of the world's horse population, there's so many disciplines, and we'd love to see the training centres now with all of them having salt rooms. There's no excuse. It's affordable. It's going to benefit the training centres, reduce your pharmaceutical footprint, and give your trainers the state-of-the-art technology they deserve. And those salt shipping containers that we showed you, they can be on a lease basis as well. So, basically there's no excuses. So we'll look forward to more of that. And I thank David and his team for giving us a platform. He certainly doesn't have any affiliation with pharmaceutical companies in that regard. So that's the primary reason why I'm happy to support this, and look forward to a bright future. Thanks for your time. Welcome to the HorseTech Conference, San Diego. My name's Richard Butterworth from Equine Salt Therapy. We have a patented technology that is granted in most equine countries around the world, North America being one of them, with USA, Canada, Hong Kong, Singapore, South Africa, New Zealand, and around the UK and other countries, just to name a few, Australia, New Zealand, and So what we are into is sustainable alternatives, and they require a blend of vision, innovation, and there's a few points here about what we're doing with relation to alternatives to traditional medications. For example, in North America, there's a wind back of Lasix, and also clenbuterol's being banned in any civilised country. That is certainly the case for Olympic and human use, but now it's extended on to equine athletes as well. So it doesn't leave much in regard to respiratory treatment when you're looking to combat things like herpes, equine herpes virus, and other things that are shutting down racing centres all around the place, particularly in California and such like at present. In Europe, you can have a stable closed down for mucus issues for a whole year. But what we've been able to do with Equine Salt Therapy, with guaranteed success within 3 treatments, to get the mucus scores down from 5 to 0, with the only exception being those that have had tie-back or forward surgery. Those horses, we get them down to a grade 1, which is adequate for an athletic horse to perform. So what does that mean to an industry? It means bigger field sizes, less scratchings, more confidence for the punters to get on there and have a bet, so they know that the horses are clean-winded and they're running without any of those issues. So we've got many, many case studies and compelling stories that we can relate to, with Anthony Cummings as well having recent success at Group 1 level. We've had many horses that he attributes to direct access to the salt therapy rooms. And what we are also dealing with in California is selenium deficiencies in the equine environments. And we might mention now how the equine industry is increasingly embracing our salt therapy, which isn't just for equine. We've used equine as a proving ground, much like Formula One in car racing does. All of those technologies flow down to domestic animals, in our case, domestic animals. In the racing industry, domestic cars, ABS brakes, traction control, all of the safety measures and everything come out of Formula One. So in the animal kingdom, our patents cover all animals, particularly livestock, which includes farm settings where you've got a lot of respiratory issues to do with poultry, swine, any of those high density farming environments. We can be of benefit there. And the patents even extend as far as companion animals, cats and dogs, as well as even, believe it or not, bees that are suffering issues with varroa mite and other things like that. We can certainly help with the technologies that we have in getting on top of those things by infusing some of our treatment salts with rosemary oil and other things that have proven to be effective in the case of varroa mite, in terms of keeping that on track with regards to the bees. There's definitely a healthy case to answer for that. So what we're finding is that in North America, Canada, the track onto and Century Mile, Century Downs, those sort of race course management people, they're very supportive and they're wanting a drug-free future. And a lot of the countries we sort of operate in, harness horses tend to suffer for funding, which directly affects horse welfare. So all I can sort of say about that is that in North America, the slots at the casinos and whatnot, all of that money goes into the purse and prize money for the harness or the trotters around in North America. So they're running around, for $8,000 per race, instead of in Australia, you'd be lucky to get 4,000 Australian dollars. So it's equivalent to 10,000 Australian dollars versus 4,000 in Australia. So what happens in Australia is they can't really afford basic things in terms of upkeep, let alone anything extra that's going to help the animal. So we find horse welfare and the approach to the industry is great in North America, especially Canada because they love and care for all the horses, but they're able to afford a high duty of care because, one, the industry and track managers are embracing our technology and making it accessible to the extent where they're putting on pizza nights and introducing us to trainers and being very progressive in their thoughts. What they want to do is a reduction in subtherapeutic use of antibiotics and other injectables, so they virtually all end up in the water supplies at these training centres and they're unfilterable. So that creates a problem with ABX stewardship, that's the antibiotic stewardship. You'll find a large contributor to superbugs is livestock and farm settings, and that is including racing centres and whatnot. So I've found Japanese vets, the government people from JRA, awfully embarrassed with their overuse of antibiotics. They've told me at Flemington in our spring carnival in Melbourne on numerous occasions, Richard, we have no choice. If the owners say they want the horse on antibiotics, we have to give them antibiotics. No, you don't. There's other antimicrobial opportunities, and we're certainly at the forefront with our technology. The reason we talk about the patent and the importance of that is because the integrity of the antimicrobial treatment needs to be consistent and it needs to be effective and safe. So make sure you have a logo like this one here, whether it's green or red, that's a Canadian one. We've set a company up there, and also the green logo as well is a registered trademark. So the regulatory vets, there is labelling requirements for treatment salts in race settings, and it must be with all of this on there as well. Now, I'll give you an introduction to Equine Salt Therapy and introduce Equine Salt Therapy, and I'll explain a bit about the science behind it and the benefits such as improving respiratory health, enhanced performance and natural recovery. And I'll try and underscore how it's a game changer in the equine care. So what it's enabled us to do is work as a training aid. So you'll know the Australian swim team, very successful. Happen to have my cousin as the head coach running the Dolphins, and they have had issues with when they're trying to use some sort of, you're going to have to excuse me for a minute because I've got a phone call.